Kenneth. I'm the Academic Registrar of Lacor Training Institute. I've been for this training for 5 days now, and I want to thank Bosco Uganda for this initiative. We know that we have been having challenges that we identified during our continuous meeting in the school, that is the management and the board. So after that, we realized that there were some challenges that we are facing as far as computer knowledge and application were concerned. So this training helped us a lot. I know in day one, we had a lot that we were not able to know before. You know, many people sit behind a computer, but there are so many things that sometimes you pretend to know when you are not. So we learned the Microsoft Word, Microsoft Excel, and then the PowerPoint. I know as the academic registrar, usually we write a lot of letters. And then when we come to Excel, we do a lot of calculations, student data, and then also when you come to PowerPoint, we teach. Like myself, I teach in the school, as well as I have to present certain things to our colleagues, as far as also to the hospital management. So this training has helped me a lot, much as there are certain other things that I've not been learning. For example, like today, like Zoom meeting, which I'm learning, I think is going to help us a lot. I know we have been having meetings using our PowerPoint, our projector, when we had a meeting with the UCMA. I think that was how I started to learn that Zoom meeting was okay.
I am Nancy Akela, working in the hospital as a nurse in a COVID treatment unit, as a nurse in charge, and also part-time in the school. We have gone through this training by Bosco Uganda, and I was very pleased. What we have learned, for me, it is going to, through continuous practice on the computer, is going to add up onto my skills. I'm going to do better than before, and it's going to help me also extend my teachings, since this time the students are at home.
I am Ojok Godfrey Kingston, a clinician who works in the Department of Internal Medicine, based in the medical outpatient at the moment. I have been in this training for the days we have been undergoing the sessions. It has been wonderful. I think the packages that we covered were very relevant to the team, and I believe if after a given period of time the trainers would get time to come and assess and see how best their students have done, they would also appreciate. And I would recommend that if new people come on board, this type of training should be offered to them so that they are able to carry on with what we have already started.
I'm called Daniel Komakech. I work here in Lacor Hospital, and I'm very grateful for the administrators for providing us this training on ICT. I work in the Department of Ops and Gyn, and as an in charge for postnatal and family planning clinics. But at the same time, I also part-time in the school, and I teach palliative care and guidance and counseling. Particularly, I've been very pleased with this training. So far, it has been the best training in computer I have ever had, because so many things that I did not know how to. I used to do others a bit manually. But I used to learn so many shortcuts, especially when it comes to Microsoft Word. I'm able to type, and then it used to be hard for me, like when I want to present and take the PowerPoint presentation. But at least I've learned this skill, and I'm very grateful.
I'm Udong Michael, Laboratory Scientific Officer, working for Lacor Hospital. And I'm privileged to have this training by Bosco Uganda, and this training will enable me to do a lot of things. Number one, as a scientific officer who is always on bench, I'll use these skills that I've gained in this training to generate the temperature chart that we always do manual. tabulating the statistics on the results that we normally work on, the diagnosis. Another thing I've learned is also how to present my data that I've used, like the statistics for the year. I'm able to present it on a PowerPoint, which is quite amazing.
So as academic registrar also, I will be in position to link with other colleagues to see how best, especially tutors, how to put this into implementation. Because my work is to coordinate learning and training in the institution. That will be important for us. I know the student will also be appreciative because many of us have not been using computers. We need to be with the world because the world is moving. We should not be left behind. So this one is going to help us to also impart the knowledge to the student. So I want to thank Bosco Uganda together again with the hospital management to support this. With this, I think we can move forward, we can continue to see that we are not lagging behind the world. Thank you very much.